we always want to advocate for the most effective care, obviously. And one of the more recent trends has been to find that arthroscopic surgery of your knee is sometimes not helpful, especially in the setting of a torn meniscus if you have arthritis in that knee. And to write that well and to say, if that person has degenerative arthritis and they tear their meniscus, you don't need to necessarily repair that. It takes time, and then people are upset because that's what they've always done, is repair the torn meniscus, and they wonder why we're not, letting them do that anymore. And on the flip side of it, there are advances. And a great example of this, I think, is cervical disc arthroplasty, where instead of going in, cutting bone out, and fusing it, you actually put a little artificial disc in. And there is now long-term data that shows that can prevent what they call adjacent segment disease. So you don't have as much disruption. And you have better mobility. So if you fuse, you're not able to do this anymore, and so you have more flexibility. But it took us a while to get there because the data was supplied by pharmaceutical companies. Even though they were FDA approved, we didn't have the long-term follow-up that we were really looking for, because sometimes you just don't know. People may remember looking at bone marrow transplants for breast cancer. And there was actually a legal case involved, and the legal case won. And so the insurance companies had to pay for bone marrow transplants for breast cancer patients. And we eventually found out that they didn't work. So it can be, it's a process. Yeah. And so for ortho, I think those are some of the moving parts. And some of them, like, bunionectomy just never changes.
Yeah, it's the same old thing.
It's the same old thing. It's one of my favorite guidelines to write. I'm like, what's new with the bunions? Not much.